but I want to tell you a story. A few weeks ago, I was doing a Q&A podcast, and somebody asked me a question about root canals and was I aware of the potential side effects. And since she had one, she's dealt with some really bad health issues and she got a cancer diagnosis. And I was like, this is very interesting. So I went down a rabbit hole and I came across a guy that I'm sure you'll be very familiar with, Weston A. Price, and some of his early research in the early 1900s. And I was blown away by what I found about the detrimental effects of what can happen after a root canal and how it can be tied to so many things, from neurological issues to increased risk of cardiovascular disease. How crazy and deep does this go? What's the problem with root canals?
Yeah, first of all, root canals is probably the most controversial topic in the whole dental medical world, because obviously a root canal is a fine art. Yeah, you have to give this to the endodontologist, and you need it as an acute pain treatment. So like if you had a tooth decay that goes till the nerve and you are hurting, and tooth pain is brain pain, yeah, it's like a neuralgia pain, it's hell. You need someone to help you. Obviously, this is only a quick fix and a band-aid for the lifestyle that led to this tooth decay in the first place. But therefore, there will be very much a lot of root canals performed per year. I think it's like, well, I don't even know the number. It's in the millions per year. So it's a big business also. And it is taught in dental school to be something amazing. And funny enough, I think 80% or the biggest part of the 30 to 45-year-old dentists become specialists in root canal treatment. Because it's a safe thing. You help people with the pain. It works. It's conventional. It's simple. You can use a microscope. But here comes the kicker when you look at it from a biological point of view. So you have to see, for biting, it works. For getting you out of pain, it works. But what you do basically is take out the vitality of the tooth, take out the blood supply, the lymph supply, and therefore the complete immune system. If you also look into a tooth, just one rooted tooth, on an electron microscope, you can see that there's about 30 to 75,000 dentin tubules. And it's kind of like a tiny cave system. So if you add all these tubes in length, it's around about a kilometer of length just for one root. And
Wow.
in these dentin tubules is where the bacteria are harboring. So they're just chilling in there. It's like the perfect cave for anaerobic bacteria, for parasites, for whatever. And the best thing is, because these tubules are so tiny and the microbes are, let's say, they are polymorph, so they can change. They can be a bit thinner because they only have like one cell. Our innate immune system, which is macrophages, they can get in. So what they do, and this is what I describe to patients always, is like the cat and mouse thing. You have the mouse in that hole, which is the bacteria in the root canal, and then the cat would be the macrophages producing a chronic inflammation and a cyst, for example. And if you look at root canals on a cone beam scan, which is a three-dimensional X-ray that not many dentists have, and you really be true to your diagnosis, 80+% have a chronic inflammation. And we know that chronic inflammation is killer number one. So that's really, really hard. And also, obviously, when you have bacteria living in there, they are producing their metabolites. So they eat the same stuff that we eat, and then they gas it out. And those metabolites you can measure. They're called thioethers and mercaptanes. And you can become allergic to them. And also they're another burden for your liver to detox. So you have a chronic infection, you have a lot of toxins, you have a dead organ, and a dead organ, like a dead piece of meat, will decompose. Just normal. It stinks and it gets black. And you can, as a dentist, you can make the perfect root canal and have this tooth on top, and underneath everything is black because you can mask it so good. But there's no medical department that would allow a dead body part in the body. It's like the most unnatural thing to do. So yes, it can be the splinter that needs to be removed in order for your nervous system and immune system to recover and heal.
Is there hope for people that have had a root canal and might be dealing with what we'd call mysterious symptoms? They've, oh, that's interesting. I'm putting things together, and maybe they feel like the diet is good and their environment's good and they're keeping a low stress and they've got something they can't quite get over, and all of a sudden some light bulbs are going off that now I haven't thought to look in my mouth. Maybe I've had a root canal. What would the healing for something like that look like?
Yes, this happens a lot. So the patients I see nowadays are more in this realm of biohacking, health optimization, health enthusiasts that are just looking for the next level. It's not only the end stage patients anymore, luckily.
Mm-hmm.
It's more fun to help, really be able to help heal faster. And yes, there are good solutions, but you have to understand that we would plan. So our goal is to restore that mouth to as natural as possible. Obviously, we take out all root canals. We take out all the metal safely, and we take care of these wisdom tooth sites. We can touch that later. But what we do is a specialty. We can remove a tooth, a root canal tooth, and take it out, clean that socket, use ozone, various things, and then place an immediate ceramic implant. And the ceramic implant is a true biomaterial. It's not a titanium implant that 99.7% of all dentists place. It's a ceramic one. Placing this for more than 10 years, I've placed more than 5,000 pieces. We now know since last year it is medical guideline. So finally, they cannot attack me for this anymore because it's the next level. Just lots of pioneer and trailblazing needs to be done, especially in the medical and dental world, because we're just having bigger egos, I think, and we're brainwashed from university. But luckily, ceramic implant studies coming out. We did a lot of those because we have just the clinical data. We can show that taking out a root canal with the right protocol, you have to really know how to do this. We have built an oasis of health and prepare patients. We can touch that in a second. But if you then have the right protocol, like imagine you had a root canal, I want to take it out, and we do this in one session, like tooth out, implant, temporary. Wait for 3 to 4 months, get the crown work, and everything stays stable because this ceramic implant is kind of like a tent pole that will keep the socket, which is the bone, and the gum alive. So you don't. So in comparison to conventional dentistry, is you have a root canal with a cyst, we have to remove it. Then we wait for 3 months. Then we do another cone beam to see, we lost all our bone. We have to rebuild bone. Takes another 6 months. And then we do the implant, which is titanium, which is the same problem as a root canal because it activates the same innate cytokines, TNF alpha, interleukin 1, beta, NF kappa B, all these things. So I'm very happy that we have a ceramic implant in our toolkit to restore this, because therefore, patients can fly in from all over the world, and they do, and have a health optimization week, and we do it all in 1 week. And then they come back, let's say 3 to 4 months later, and do the final crown work. And it saves you so much time. That's why it's so charming, and is extremely minimal invasive, pain-free, almost pain-free treatment. So it's just a win for everyone.